Case 3. This is a 76-year-old woman with a history of cardiovascular events, stroke among them. She herself and her referring physician felt a palpable lesion in the medial half of her left breast. Let's look at the multimodality workup result. We mark the area where the referring physician and the patient thought that there would be a palpable lesion, but on the medial lateral and on the CC projections, we couldn't see any tumor mass, any malignant type calcifications. I'd like to make a note. We could not position the patient better. She was in bad general condition and she was after stroke. But the impression is interesting here. She's 76 and she has dense breast tissue, very extensive. This is what we call pattern 4, that is the adenosis pattern. Prominent ducts and large terminal ductal lobular units that never change. If we were taking a picture about her when she's 90 years old, she would have the same type of mammogram. In these cases, very often, we feel lumps. But the conventional mammogram couldn't show any tumor mass or calcifications in either breast, not even on the microfocus magnification images of the region where the referring physician thought to palpate an abnormality. Then, because of the very extensive fibroglandular tissue, we performed ABUS. And ABUS provides these beautiful 2 millimeter thick consecutive coronal tissue slices. Here is the skin level, and then the 2 millimeter and the 4 millimeter deep to the skin. Of course, we are not going to expect adipose tissue, or not much anyway, in these slices, because the fibroglandular tissue is very close to the skin and it's getting larger and larger the closer we get to the chest wall. But what is interesting is that we are talking about the right breast. This is the acquisition in the medial half of the right breast, and there is a tissue defect, and there are several tissue defects here, and they just increase in size, and eventually you put the cursor there, and we got the two-dimensional reconstructed ultrasound image, which suggests a malignant lesion. Then we perform immediately the handheld ultrasound, and it shows multifocal lesions. This is a Doppler image. And the lesions are localized in the right breast in the medial half. 14-gauge core biopsy is done on one and the other, and a microscopic examination proves that these are invasive carcinomas. Also, the axillary lymph node looked pathologic on the right side. Final histopathology shows that we are facing a multifocal breast cancer. The somewhat larger is 13 by 12 millimeter, and right after that, the 12 by 10 millimeter. These two were seen on ABUS, and this one, of course, is the finding by the pathologist. Unfortunately, the larger one was poorly differentiated cancer, and it was associated with grade 3 in situ carcinoma as well. Total disease extent was 52 by 25 millimeter. Fortunately, the 7 surgically removed axillary lymph node did not have metastasis, but it's a highly proliferative carcinoma. So in this case, the teaching point is very similar to the teaching point in case 2, namely when we combine the full-field digital mammography with ABUS, we are going to find a large number of cancers that mammogram misses, and they can be on the ipsilateral or in the contralateral breast.